Welcome to the deep dive. You know, it's funny. You wake up, you get out of bed, you walk to the kitchen to grab a coffee.
Right, just autopilot.
Exactly. You do it without a single conscious thought. But underneath the skin, that act of just putting one foot in front of the other is, well, it's this incredibly complex mechanical puzzle.
Oh, absolutely.
I mean, we expect sophisticated engineering in like our smartphones, but the biological machinery that allows you to walk is actually pretty staggering.
It really is. We tend to just assume it'll always work, until we tweak something and suddenly we can't even stand up.
Yeah, totally.
The sheer level of coordination required to just keep your center of gravity balanced, let alone propel like 150 pounds of body weight forward is massive.
And that's our mission today. We are deconstructing the anatomy of your hip and thigh using this really comprehensive anatomical breakdown from KenHub as our guide.
Right, the KenHub material is great for this.
It really is. It details the origins, insertions, and nerve pathways of all these muscle groups, and looking at the sheer volume of material in this text. Well, I'm not gonna lie, it's a lot of Latin.
Yeah, it can definitely seem like just a wall of dense terminology at first glance.
For sure.
But the beauty of this anatomy is that none of these muscles act in isolation.
Wow.
They form this beautifully coordinated pulley system designed to stabilize your pelvis and make dynamic movement possible.
Okay, let's unpack this. If we really want to understand how you walk, we need to look at three main functional groups.
Right.
We have the iliopsoas group, so these are your flexors, the muscles pulling the strings to lift the leg. Then the gluteal muscles, the heavy lifters and stabilizers.
Right, the powerhouse.
Exactly. And finally, the hip adductors, which provide the inner tension so you don't just, fall over sideways.
Which is the perfect order to tackle this, really, because mechanically speaking, before you can take a step, the absolute first thing you have to do is lift your leg off the ground.
To clear the floor, yeah. And if I had to guess which muscles lift my leg, I'd probably point to the top of my thigh, maybe the quads.
Most people do.
But according to the KenHub breakdown, the true starting point for this movement is actually way up in your back, like in the posterior abdomen.
Yeah, deep in the back of your abdominal cavity. The iliopsoas group is primarily made of two distinct muscles that they start in completely different places but eventually merge.
Okay.
You have the iliacus and the psoas major. The iliacus is this large, flat, triangular muscle sitting right in the iliac fossa.
Hold on, let's pause on the iliac fossa for a second. For the listener trying to picture this, is that basically the inside bowl of your pelvic bone?
Spot on, yeah. Imagine your pelvis as a large bowl holding your lower organs.
Okay.
The iliacus lines the inner curve of that bowl.
Okay, got it.
But the other half of the team, the psoas major, originates even higher. The text notes it attaches to the T12 through L4 vertebrae.
That's the lower spine. So you have a muscle anchoring to your actual spinal column, descending down through your core. I mean, how does it even get to the leg? It has to cross over the hip joint somehow, doesn't it?
It does, yeah. It travels down and right around the inguinal ligament, which is that crease where your torso meets your upper thigh. The fibers of the iliacus and the psoas major fuse together.
They just merge into one.
Exactly. They become one single muscle, the iliopsoas.
Yeah.
From there, they dive down and attach to the lesser trochanter, which is just a small bony bump on the upper inner part of your femur, your thigh bone.
So if I'm visualizing the mechanics here, it's almost like the strings of a marionette puppet.
Oh, I like that.
Right. The strings are anchored high up in the wooden crossbar of your spine and pelvis, and they run all the way down to the puppet's knee. When those muscles contract, they pull the thigh bone up toward the trunk, you lift your knee.
That is a highly accurate way to visualize it, because they cross the hip joint from the front, they act as the primary flexor of the thigh. But it's not just a simple mechanical rope. It is deeply integrated with your nervous system. Remember, the psoas major attaches to the lumbar spine.
Right.
Because of that location, part of your lumbar nerve plexus is actually embedded right inside the muscle belly itself.
Yeah, the source mentions it's innervated by the anterior rami of spinal nerves L1 through L3.
Yes.
And anterior rami, that just means the front branches of the spinal nerves coming off the cord, right?
Precisely. These front nerve branches plunge directly into the muscle tissue. And mechanically, this means the psoas major doesn't just pull the leg up.
Wait, what else does it do?
Well, if your leg is planted on the ground, contracting that muscle will actually pull your torso down, flexing your trunk forward, or pulling it to the side. It physically bridges the upper and lower halves of your body.
Wow. Now, as I was reading through this section, I noticed a bizarre little detail.
Ooh.
Yeah, we have the iliacus and the psoas major, but there's a third muscle mentioned in the text, the psoas minor. Except, anatomists frequently exclude it from the main iliopsoas group.
They do, yeah.
If it's sitting right there, why ignore it?
Well, what's fascinating here is that the psoas minor is what we call a highly variable or vestigial structure. In human anatomy, it is only present in about 40% of people.
Wait, what? Less than half the population even has this muscle?
Yep.
So there's a 60% chance I just don't have it at all.
The odds are against you having one, yes. And even if you do, it doesn't function like the other two. To lift the leg, a muscle has to cross the hip joint and attach to the thigh bone.
Right, like the marionette string.
Exactly. The psoas minor doesn't do that. It stops short.
Yeah, the text says it inserts into the iliopubic eminence of the pelvis, so it just anchors back onto the pelvic bone.
Right, because it never reaches the femur. It physically cannot lift the leg. All it can do is offer a very weak flexion of the lower spine. It's an evolutionary leftover that doesn't pull its weight in the main leg lifting group, which is why it gets left out of the spotlight.
That is just wild to me. Okay, so our marionette strings have yanked the femur up into the air.
Leg is lifted.
Right, but right now, biologically speaking, we are entirely off balance, tipping forward with our foot just hovering off the ground.
Not very useful for getting around.
No, just lifting your leg doesn't get you across the room. To actually propel the body forward and catch our center of gravity, we need a massive counterforce on the back of the pelvis.
You need sheer power. And that brings us to the powerhouse of the pelvic region. The gluteal muscles.
The glutes.
Yes. Most people immediately think of the gluteus maximus, which makes sense. It's the largest, thickest muscle in the body, sitting right on the surface.
Right.
It originates across a really wide area, your ilium, sacrum, coccyx, and the thick fascia of your lower back, and inserts all the way down into the femur and the IT band.
So its primary job is just brute force, extending the thigh, pushing the ground away behind you.
Exactly.
But the KenHub breakdown shows that if you peel the gluteus maximus back, there's a whole secondary layer of stabilizers underneath. You have the gluteus medius and the gluteus minimus.
The deeper layers.
Right, and I imagine they aren't just smaller versions doing the exact same job.
Not at all. They sit deep to the maximus and they're fan-shaped. While the maximus pushes you backward, which is extension, the medius and minimus are primarily responsible for abducting the thigh.
Okay,
That means pulling the leg away from the midline of the body. They also handle internal rotation, and crucially, when you are standing on one leg mid-stride, they fire to keep your pelvis level so you don't just collapse on the unsupported side.
So they keep you upright.
Yes.
We also have to mention the tensor fasciae latae, or the TFL. It's grouped with the superficial glutes, but it's like a multitasker. It's the only muscle in the specific group that crosses both the hip and the knee joints.
It is. It starts at the top rim of the pelvis and inserts into the iliotibial tract.
Let's define the iliotibial tract for a second. Most people probably know it as the IT band.
Yes, very common among runners.
It's basically a thick, tough strip of connective tissue running down the outside of the thigh, right?
Think of it as a rigid biological tension cable. Because the TFL pulls on that cable, which runs all the way past the knee to the shin bone, it can stabilize both the hip and the knee simultaneously.
Okay, here's where it gets really interesting.
Yeah.
Beneath those large superficial glutes driving us forward, there is a hidden layer of tiny, precise muscles, the inner hip muscles, also known as the deep external rotators.
There's 6 of them sitting deep underneath everything. And for anyone trying to visualize this layout from superior to inferior, so from the top down, the text provides a memory tool.
Yes, I love this.
It's patch goods often go on quilts.
Patched goods often go on quilts. I love a bizarre mnemonic. Let's see. Piriformis, gemellus superior, obturator internus, gemellus inferior, obturator externus, and quadratus femoris.
You got it.
Okay, but rather than just memorizing a list, what is the mechanical purpose of having 6 tiny muscles buried this deep?
Well, functionally, their main job is external rotation, turning your thigh and foot outward. But more importantly, they are microstabilizers.
Microstabilizers.
Right. The hip joint is a ball and socket. These deep rotators hug that joint, pulling the ball the head of the femur firmly into the socket, which is called the acetabulum. They keep the joint from dislocating, while the massive superficial glutes do the violent heavy lifting.
That makes a lot of sense. Let's look at a few of the specific quirks here, starting with the piriformis. Sure. The name means pear-shaped, and it sits at the top of this deep layer. What struck me in the text is how it interacts with the bone structure. It passes through the greater sciatic foramen.
Yes.
And foramen is just a fancy anatomical word for a window or hole in the bone, but the piriformis doesn't take up the whole window.
It doesn't. Yeah. And that creates a very important geographical division, because the piriformis goes right through the middle of that window. It leaves gaps above and below it. We call these the suprapiriform and infrapiriform foramina.
So it acts like a biological traffic splitter.
Perfectly said. It creates routed pathways for crucial vessels and nerves to exit the safety of the pelvis and enter the gluteal region. The superior gluteal nerves pass through the window above the muscle, and the inferior gluteal nerves and the massive sciatic nerve pass below it.
And right below that traffic splitter, we have a cluster of 3 muscles that essentially act as a single unit: the gemellus superior, the obturator internus, and the gemellus inferior.
Yes, the text calls them the triceps coxae,
which translates to the 3-headed muscle of the hip. But hold on, I'm trying to picture this.
Yeah.
You have 3 distinct muscle bellies, starting from completely different anchor points, like the ischium, which is the bone you sit on, and the obturator membrane.
Right.
But they all merge into one single tendon. How does pulling from 3 different directions not just tear that tendon apart?
You would think the competing angles would create friction, but they don't pull against each other. They pull in unison.
It's almost like having 3 separate dock workers standing at slightly different angles on a pier, but they're all pulling on the exact same thick rope to rotate a boat.
That's a great way to put it.
They have different anchoring points on the dock, but their force is unified into one single pull on that common tendon.
That's a phenomenal analogy. By pulling from slightly different angles, they provide this incredibly stable, multi-directional rotational force on the femur without putting undue stress on any single point.
Makes total sense.
And rounding out the bottom of that quote mnemonic is the quadratus femoris.
Yeah.
As the name suggests, it's a flat, rectangular muscle, but it carries a very specific exception.
Right. The Ken Hub text points out that out of all these deep external rotators, the quadratus femoris is the only one that does not abduct the thigh from a flexed hip.
Exactly.
If your knee is lifted, the others can pull the leg outward. The quadratus femoris can't. It just rotates.
It really proves how specialized each of these tiny muscles has become over millions of years. Every single one has a highly specific job to keep that ball joint perfectly centered.
Okay, so let's track where we are. We have the iliopsoas lifting the leg like marionette strings. We have the superficial glutes providing the brute force extension. We have the deep rotators providing precision steering of the hip socket.
Yep.
But there's a missing variable. If you only had muscles pulling your leg up, back, and outward, well, you'd have no inward control.
None at all.
Your legs would display out sideways with every step. You look like Bambi slipping on ice. We need counter tension.
You need inner balance, and that is exactly what the medial compartment of the thigh is designed to do. These are your hip adductors.
Let's quickly define that for clarity. Earlier we mentioned abduction, pulling the leg away from the body. Adduction with a D is pulling the thigh inward, adding it back toward the midline of your body.
Adding it.
The Ken Hub breakdown lists 6 of them: gracilis, actineus, adductor longus, adductor brevis, adductor magnus, and adductor minimus.
Mechanically, as a group, they are incredibly unified. They share a lot of the same blood supply and wiring. They almost all receive arterial blood from the obturator artery. And with a few exceptions, they are mostly innervated by the obturator nerve, which branches out from your L2 through L4 spinal nerves.
There are a few fascinating standouts here, though. The gracilis is the most superficial of the group.
Yes.
It's this long, strap-like muscle running down the very inside of your thigh. And unlike most of the adductors that just go from the pelvis to the thigh bone, the gracilis actually bypasses the femur completely.
It does.
It crosses the knee joint and inserts onto the shin bone, the tibia.
It joins the tibia at a very specific juncture called the pes anserinus, which literally translates to goosefoot because of how the tendons play out.
Goosefoot, right. And the text gives another great mnemonic to remember the 3 different muscles that all converge at this goosefoot on the tibia. Say grace, Sarah.
Right.
That stands for sartorius, gracilis, and semitendinosus. 3 completely different muscles from the front, inside, and back of the leg, all anchoring to the exact same spot. It's just a cool anatomical intersection.
It beautifully illustrates how interconnected the entire leg architecture is. You can't move one compartment without tugging on the others.
Now, earlier we talked about the evolutionary quirk with the psoas minor missing in most people.
Yes, the phantom muscle.
Right. Well, the adductor group has its own phantom muscle, the adductor minimus. The text states this muscle is only present in 50% of adults. Again, half of us just don't have it.
And even when it is present, it is so tiny that it often just completely fuses with the top border of the next muscle on the list, which happens to be the absolute giant of the inner thigh.
The adductor magnus. I mean, the name really says it all.
It is massive. It's so large and structurally complex that anatomists actually divide it into 2 distinct parts.
Oh, really?
Yeah. You have the adductor part, which pulls the leg inward and rotates it externally. But then you have the ischiocondylar part, often referred to as the hamstring part, which does the opposite. It rotates the thigh internally and helps extend it backward.
So it's basically 2 completely different muscles glued together. And the Ken Hub text points out they aren't even wired to the same power source. The adductor part is controlled by the obturator nerve, but the hamstring part is plugged into the tibial division of the sciatic nerve.
Right.
But the part that really confused me when I was reading this, between these 2 massive sections of muscle, there is a physical hole, an opening called the adductor hiatus.
Yes.
Why would there be a giant gap right at the bottom of the biggest muscle in the leg? Doesn't that create a weak point?
You would think so, but it's an architectural necessity. That hole, the adductor hiatus, is a tunnel.
A tunnel for what?
Major blood vessels, like the femoral artery and the femoral vein, they travel down the front of your thigh. But to supply blood to your lower leg, they need to get to the back of the knee. That gap in the adductor magnus is the specific doorway that allows those major vessels to safely pass straight through the muscle wall to the back of the leg.
That's brilliant. The muscles not only create movement, but their arrangement literally builds the highways and tunnels for the body's plumbing. Which brings us to the final piece of this puzzle, the geographical landscape these muscles create.
If we connect this to the bigger picture, all these intersecting muscles at the top of the leg create a shallow space on the upper inner thigh, known as the femoral triangle.
Yeah, the text describes it as a triangular depression. It's bounded at the top by the inguinal ligament, the crease of the hip.
Right.
The sides are formed by the borders of the adductor longus and the sartorius muscles. And the floor of this depression is made of 2 muscles we've covered, the pectineus and the adductor longus.
That's the layout, yes.
Okay, but I have to ask, from a survival standpoint, having a dip in your thigh seems random. Why do anatomists care so much about this specific biological pothole?
It all comes down to what forms the roof of this triangle. Every other border of this space is protected by thick muscle or tough ligaments.
Right.
But the roof over the femoral triangle contains 0 muscle tissue. It is entirely made up of fascia lata, which is just a thin layer of connective tissue acting like biological cling wrap over the muscle along with some subcutaneous fat and skin.
So it's basically a biological skylight, a spot with no armor. That seems like a massive design flaw if you get injured there.
It is incredibly vulnerable. Sitting right underneath that thin, muscle-free roof are the femoral nerve, the femoral artery, and the femoral vein.
Wow.
But while it might be an evolutionary vulnerability, it is a lifesaver in modern medicine. Because those major vessels sit so close to the surface, completely unprotected by thick muscle, the femoral triangle is a crucial anatomical landmark.
How so?
If an emergency room doctor needs rapid central venous access, meaning they need to deliver life-saving medications or massive amounts of fluids directly into your core circulation, instantly, they know exactly where to go. They locate that triangle, press through the skin, and they have immediate unobstructed access to the femoral vein.
Oh, wow. The arrangement of our walking muscles literally maps out an emergency survival pathway.
It really does.
So what does this all mean? We started by talking about how taking a simple walk to the kitchen is an engineering marvel. And looking at the Ken Hub breakdown, the blueprint is just staggering.
It's complex, for sure.
You have the marionette strings of the iliopsoas crossing through your core to lift the leg. You have the powerhouse superficial glutes driving your entire body weight forward.
Right.
You have the microscopic unified precision of the triceps coxae and the deep rotators steering the ball joint. And you have the medial adductors, the giant adductor magnus with its built-in vascular tunnels, providing the inner tension to keep your stride smooth and balanced.
It is a phenomenal interconnected system.
Yeah.
But I'll leave you with a final thought to ponder.
Let's hear it.
This entire complex, these dozens of interacting muscles, the dense fascia, the precisely routed nerve highways, is an ancient pulley system.
Right.
It evolved over millions of years for constant dynamic movement across rugged, varied terrain.
Right, our ancestors weren't just sitting around.
Exactly. The human hip wants to walk, run, squat, and climb. Knowing how intricately the iliopsoas ties directly to your lower spine, and how these deep rotators have to constantly stabilize your femur, what happens to the structural integrity of this finely tuned machinery when modern humans spend 10, maybe 12 hours a day sitting in an office chair? We are essentially locking those powerful hip flexors in a perpetually shortened, inactive position day after day. What does that do to the physics of your spine?
Wow. Now that is a thought that makes you want to stand up and stretch immediately.
Definitely.
Thank you for joining us on this deep dive into the hidden mechanics of your hip and thigh. Next time you take a walk, just take a single second to appreciate the absolute symphony of anatomy firing off just beneath your skin. Until next time, keep questioning and keep moving.